This is Jay Hodson with a trauma scenario. I was dispatched to a scene. A 24-year-old female was shot in the left shoulder. So as I arrive on scene, first thing I'm going to do is BSI scene safe. Mechanism of injury is the gunshot wound to her left shoulder. Appears I only have one patient. I'm going to go ahead and call for backup immediately. And I do not think that I need to consider spine immobilization at this point. First thing I'm going to do is determine level of consciousness. Ma'am, can you hear me? Ma'am, can you hear me? She is not responding, so it seems she is unconscious at this time. Her chief complaint was the gunshot wound. My general impression is that we need to stop the bleeding immediately. So we have gauze that we are putting on there and applying and holding it on with pressure to stop the bleeding. From here, we will start the ABCs. And so first step is we're gonna assess her airway. So I will open her airway, making sure that there's no blockages. Doesn't seem that there is. I'm gonna check her breathing now and assess her breathing and apply high flow oxygen via non-rebreathing mask. And ensure that she has adequate ventilation. From there, I'm going to check her circulation, starting with her pulse, both radial and carotid. And I will check her skin color, which appears to be pale and cool and clammy. So we're gonna go ahead and treat for shock. We'll get a blanket out here and get the ambulance warmed up and get it nice and warm in the back for her. After that, I would obtain a sample history if she were conscious, and at this time I would take her vitals. After the vitals, I'm going to start my secondary assessment en route because I have decided that this is a high priority patient that needs to be transported pretty rapidly. So in the back of the ambulance, I would do my secondary assessment, starting with her scalp, palpating the entire scalp, checking her ears, mouth, nose, and assessing her eyes, pupillary reaction. And from there, I'm going to continue palpating, assess her trachea, ensure that it is still in the middle and it hasn't been injured. Check jugular veins, continue palpating her chest, as well as her abdomen, her pelvis, not going to check her genitals at this time. Continue palpating her legs all the way down. I'm going to check for pulse at the distal end of her lower extremities. Then come back up and assess her arms. Again, checking for that radial pulse there on both of the upper extremities. And I'm gonna continue monitoring her vitals every 5 minutes. And get her to the hospital. And that's all, folks.